Okay, and the last thing we're going to talk about is enemas, different types of enemas, why people need enemas. So as you can imagine, I'm not going to assume that people know what they are, so I'm going to explain the whole process. When somebody is constipated and they have a difficult time having a regular bowel movement because they are constipated, whether it be dry, the stool is dry and they can't push it out, sometimes we need an enema to soften the stool and make it where it can be easier expelled. Okay, so there are different types of enemas, and what you see here in front of the sink, there are 3 Fleets enemas, and the kind of orangish box there is a mineral oil enema. It's also made by Fleet, but these are considered a low volume enema. Okay. They come in a package. Okay, this particular one has 4.5 fluid ounces. Okay, it's got a lubricated tip. When you take this cap off, it is already pre-lubricated. Okay, and it is ready to go at that point. Okay, you don't have to do anything to open the seal. It is actually ready to be pushed into the patient. Okay. So the way this works is it's lubricated, and just like rectal temperature, you're going to have a chucks down by the patient, have them lying on their side, and you're going to go and push this all the way into the rectum. Okay. Once it's into the rectum, okay, so we're going into the rectum here, you start to push the fluid in. Okay. And as you push the fluid in, you want to give it some good pressure so it'll go on up into the colon. Okay, and you want to roll it, sort of like your toothpaste at home. You want to roll that and get all that fluid in. Okay, this low volume enema, which is, like I said, 4.5 ounces, you want it to sit there for roughly 10 to 15 minutes, if at all possible. Okay, and what this will do is soften the stool in the lower part of the colon, and it will eventually create the person to feel like they need to have a bowel movement. And of course, you don't refill these back with water, just putting it there for demonstration purposes. Okay, and then hopefully that would stimulate a bowel movement. Maybe for whatever reason the intestinal tract needs to be lubricated with mineral oil. Well, the mineral oil also will irritate the colon, which will create the patient to have a bowel movement. So this looks just like the Fleets, but it's got mineral oil in it. And that one's been used before, and it's true mineral oil. Again, this is Fleets. As it says, comfort tip. It is flexible so that we don't do damage to the patient. Try not to do it on a patient with hemorrhoids, but sometimes you just can't help it. You just have to be careful. But that tip is very flexible, okay, so that it doesn't do damage. But sometimes the Fleets enema just isn't enough, and we have to do a cleansing enema. And this is what would be considered a soap suds enema. So you get your package, and in here you would have, there's the cap to the tip that's pre-lubricated. So that would have lubricating jelly in it. This is so old it's sticky. So when you're giving an enema, the first thing you want to do is make sure that the tube is clamped off. Okay. Next thing you want to do, these enema bags have a lip. Again, this one's so old. That you pour the water into, and you want it to be rather warm. So you use hot water, and you fill the bag up. Now this would be for somebody who's truly constipated and maybe even impacted. Okay, so you would have your IV pole hung up, and you want to give your enema about 12 to 18 inches above the patient so it would flow in. Okay, so that's on IV pole. We're then going to open the clamp so that it will prime the tube, just like IVs. It primes. You can see it moving down the tube there. Okay, and then once it's primed, same thing as with a Fleet, we clamp this back off, Once it's primed, we take the tube and insert it into the rectum, going past the internal sphincter. What we have to do, make sure Chucks is under the patient, leave that there until the whole bag runs in. You have to encourage the patient to stay on the bed until the whole bag runs in. That way the fecal material can absorb the moisture, absorb the water, but that much pressure on the intestine is also going to create the patient to feel like they really have to have a bowel movement. So usually when we do a enema this way, we need to have a bedside commode right there. The patient generally is not going to make it to the bathroom, okay, unless you're going to want to clean a trail from the bed to the bathroom of fecal material, which is not fun, okay. So I'm going to leave this out for you guys to look at. The other thing, if the doctor has ordered soap suds, after you fill it with water, there's always a little pack of soap, and you just open it up, fill it up with water, put the soap in after you fill it up with water. Don't put the soap in first or you'll have bubbles coming out of all the top. And what that soap does is it irritates the colon to create peristalsis, thereby helping the patient to have a bowel movement. And that is what an enema is. Okay. If you have any questions, email me. All of these materials are still in the lab for you to look at, and I hope y'all have a good week.